the title's going to say is post-COVID syndrome, what it actually does, what it means, and how it's affected me, and why I have not been active on YouTube or making videos, and how this has looked for me and how it's looked for many other people. So if you did have a level of autonomy, if you were used to shooting and you were used to carrying out your daily life activities and then they got fucked suddenly, keep watching. If you didn't, watch it anyway, maybe if there's someone in your family or someone that you know that has experienced similar neurological and cardiac symptoms, that the video may help. I don't really know, but I'm going to go over it anyway because I've alluded to it quite a bit in other videos. So anyway, long story short, and then I'll go into the symptoms. Contracted COVID, myocarditis, which is swelling, affected some of the issues with the heart. Later on, I am an LPCC-S, licensed professional clinical counselor, - with supervisory designation. I run a mental health agency, co-occurring diagnosis, or dual diagnosis, so people suffering with both substance use disorders as well as mental health issues. We also do full-blown mental health, outpatient services, everything. But anyway, that means that I'm technically kind of a first responder. I kind of am, and was kind of forced to take the vaccine. Anyway, exposed to COVID quite a bit during the outbreaks as a result of that, no matter how careful I tried to be, due to the impact it would have on some of my mom, for example. She has a compromised immune system. I was never typically worried about what it would do to me, but my daughter was young at the time, as well as my mom was. I wouldn't say she's elderly because she'd get pissed if she saw this, but she did have a compromised immune system. So, moving forward, contracted COVID again, woke up, heart rate was in the 180s. There was no stimulus to have resulted in the heart rate being that high, but heart rate was extremely high, sweating, basically everything that would indicate either a panic attack and or cardiac symptoms. It's kind of hard to differentiate between the two at first unless you do an EKG. So EMTs come, hospitals are packed, they do an EKG, they're on the phone with the cardiologist, they're like, what are the other symptoms, blah, blah, blah. Due to having COVID the first time and having, some symptoms, I did have some emergency breakthrough tachycardic medication I had taken, and it wasn't being effective. So they go ahead and tell me to increase the dosage. Eventually my heart rate dropped. The EKG went from abnormal to normal. Follow up with the cardiologist the next morning. And they basically said, we don't know what the hell happened. We really have no idea. Your heart doesn't seem to be damaged, but we don't have any... we can't do an echocardiogram because we don't have access to it because they're all in the COVID wards, and yours doesn't appear to be a significant emergency, so wait it out. They told me it'd be about a week. It took about 3.5 weeks to get an echo, and by that time there was no swelling, no indication of any more damage to my heart than already was, so they just increased the tachycardic medications and chalk it up to, I wouldn't say an isolated event, but kind of an isolated event. So, moving forward, shortly thereafter, I wake up with like the most severe headache that I can describe. Prior to this, I did suffer from migraines. And what seems to happen with COVID is it takes anything in your body, anything in your system that was already kind of weakened, and just amplifies it by like tenfold. And just attacks the fuck out of it until it finds a way to just, like, destroy you from the inside out. I wake up and I feel like my brain's on fire, to the point where I could not drive myself to the urgent care. I told my wife. She takes me in, they swab me, they're like, man, you got COVID, and I was like, that doesn't explain the headache. They're like, it kind of does, that's a symptom of COVID. And I was like, my brain feels like it's literally on fire. And I was like, and I know that your brain cannot feel pain, your eyes cannot technically feel pain, that is your brain's way of saying there's something wrong. My neck was hurting really bad, and they were like, well, you were uncomfortable, you were sick, you are sick, you slept weird, you probably pinched something, we're going to give you some Toradol and some shit. And that will help with the inflammation response that your body's having, because your whole body kind of gets inflamed with COVID. And go home and rest, and watch if watch eating, drinking, fever, blah blah blah. If you have any symptoms, come back. Make sure you're taking your cardiac medication, because COVID will reattack the heart. Honestly, if you have cardiac issues, once you develop them, anytime that you get sick, you need to watch cardiac symptoms, because they will flare up. moving forward, like during that week of rest due to having, full-blown COVID, that was the first time I can say I had full-blown COVID. The other time that I had it, the only thing I really felt was the cardiac symptoms, and by that I was dizzy, and, blood pressure's high, your heart's racing. My blood pressure was high, and so I felt dizzy and I felt really fatigued, but I didn't feel like, death and, laying in the darkness, not being able to look at light, praying for, something bad to happen. So, the reason I keep messing with my hand is somewhere throughout all of this, I developed, there was a secondary infection going on that they ignored, and I'm not blaming anyone, I'm not a lawsuit chaser, ambulance chaser, whatever, but something happened, and that resulted in basically meningitis, rapid onset swelling of the brain and the spinal cord. So C1, C2, C6, and C7, as well as my temporal lobe, suffered a lot of damage. So that resulted in a lot of neurological damage, so blindness in my right eye. I'm now left eye dominant, which is kind of shitty, but kind of cool at the same time, because it's very interesting the way your brain will rewire and reroute itself. So what had happened is during this time, I would go to pick something up like the remote and I'd drop it. I'd go to grab my glass of water and I would drop it. Moving past the time of actually that week of having COVID, the symptoms kind of persisted and they got a little bit better, but then they got a whole lot worse. So I would go to reach for something, and if I wasn't looking directly at it, it was like I wasn't holding it. It would be gone. So I realized that I really couldn't feel these three fingers. And at times when I can't do it on purpose, but when the symptoms are pretty bad and they're flared up, if I try to move this hand, my ring finger and pinky finger are completely out of sync with every other finger. Like my ring finger won't even move. It's like I'm trying to move my hand the way it should move and it won't. So, long story short is when you have that level of neurological damage and nerve damage, it causes seizures, more or less, transient loss of consciousness, because your brain cannot process the amount of, well, honestly, pain, but your brain's trying to send signals, trying to process what is happening, and why the signals can't really go anywhere because of the damage and the inflammation, and you start having blackouts, and I don't know how long they went on. The first one I remember, I was at the range about a year ago, and I just, I was having some mild symptoms. My eye was hurting a little bit, which means, again, your brain does not feel pain. Your eyes don't feel pain. It's your brain telling you something's pretty fucked up. So I couldn't really feel it. They'd been treating me just for normal migraines, wasn't getting any better. Actually, things were getting worse, and I passed out at the range. And my range is very isolated, so I don't know how long I was out. I, came to, made it to the shop where my best friends work, and they call my wife, and she comes out and gets me. My buddies later drive my truck home for me, and, go to the doctor. They're like, well, you didn't have a heart attack. We don't know what happened. There's no troponins being produced. Everything seems to be fine right now. But they weren't considering the neurological aspect because they said there was nothing neurologically wrong with me. I'd already been to a neurologist. Well, I go to Cleveland, and it turns out that the doctors around here don't know fuck about shit. So within 45 minutes, the doctors at Cleveland identify that I've had a significant loss of muscle mass in my right side. That my right side is very atrophied compared to my left side, which is weird because I am, or always have been, right hand dominant, right eye dominant, and that would explain why I couldn't shoot worth a shit and why I was dropping stuff all the time. Now the weird thing is, as I mentioned earlier, and I'll use a magazine for an example, if I was looking at what I was trying to grab, my brain would perceive that I could feel it. But if I wasn't, it was like these three fingers. If I tried to grab it like that, I'd be fine. But if I tried to grab it with full hand, it was like my brain would not identify that there was anything in my hand. Which, honestly, if this wasn't, even though it is happening to me, I do find the symptoms very interesting with my field of work. But, it still fucking sucks. So, moving forward, things just got worse from there to the point where, driving became extremely difficult. And I don't know why the fuck trains have to come by whenever I'm trying to do this type of shit. But basically, they really frown upon you driving if you're losing consciousness. I don't know why. This seems a little communistic to me, but they really frown upon it. So, a couple different stays overnight, a surgery to have a cardiac implant put in to basically be running EKGs constantly and monitoring my heart, as well as, you know, Cleveland doesn't just admit you for the fuck of it. So a 7-day lovely vacation in Cleveland. By the way, if you've never been to an EMU or an epilepsy monitoring unit or a seizure unit, it's basically like torture. I'm talking about sleep deprivation. They were doing their job, and they were very nice. I hated the experience, but I loved the people, if that makes sense. Because you're being woke up, you're sleeping about 45-minute periods, but they're wanting to try to trigger any level of neurological activity, and that tends to happen when you are sleep deprived or also, you know, getting strobed. So watch our early videos on the way we interrogated people after 9/11. Outside of the waterboarding, you'll pretty much get the gist. So I'm talking trash. Cleveland Clinic has been amazing, and it was really not that bad. It was really just sleep deprivation, and I requested it because I wanted something to happen while I was there. While I was there, if it was going to happen, I wanted them to see it. Luckily enough, they did, and it turned out it wasn't a seizure. It's due to transient loss of consciousness due to the nerve damage and my brain not being able to process the amount of pain and other things that are happening. Anyway, in summary, if you made it this far in the video, if you have experienced any of these things, then you have like a loss of autonomy, you have a loss of your ability to function as you were. I lost basically my primary hobby, shooting. I lost my ability just to say fuck it and go drive somewhere by myself. I did gain a lot, and I have a lot of support. I'm very happy for that. There's nothing about this means of this video to intend that I'm ungrateful for what I do have. The point is to share what I have lost or what I don't have anymore, so other people may, if you're going through the same thing, you know that, as corny as it sounds, that you're not alone, or that other people are experiencing and have experienced. I tried forums through Cleveland and through Johns Hopkins, and it was a lot of people complaining, but not really any, hey, what did I do? To be honest, I've done just about everything that I feel that I can. Things still are not where I want them to be at all. But I do have, unfortunately, I do have a friend at work that their symptoms are almost identical, which is kind of why I maybe believe that it was the vaccine that caused a lot of this and not the actual virus. Combination of both, maybe. Who knows? But being able to have someone else to know that you're not crazy, because if you're going to doctors, you're not getting answers, you do start to feel like you're fucking crazy. You think that it's in your head and that you just need to like fucking check yourself into a psych ward because you're experiencing these things, you're feeling them, you're living with it, but yet they don't know what's wrong with you, and it really does mess with your head. And I am a trained, licensed professional. I've been practicing for about 20 years, and it really does start to feel that you're going crazy because people cannot identify, the doctors, specialists are having trouble. If I wouldn't have went to Cleveland, I don't know really how far things would have went, because around here locally, they were basically telling me that you're having migraines, you're really not that bad off, just get over it, was the gist of it. I go to Cleveland, and the first thing the doctor says is, look, I don't know what's happening, but I can see something is happening. I can see it both through what you're telling me and through telemetry, through test and measurement. I can see that something's happened to you. People just don't lose muscle mass or start dropping stuff. They just don't like have the symptoms you're having. I can tell that something has happened to you. Now we just have to figure out what. So them actually confirming, hearing a professional, a doctor, a specialist say, look, I know you're not crazy, meant a lot to me. Now, I'm not telling you, I'm not a doctor, I'm not giving you medical advice by any shape or form, but what I'm saying is that if you made it this far in the video, you are experiencing this, or you have a friend that is, and good luck. I hope that this helps you, and if you need anything, hit me up in the comments, and I will talk to you as much as I can. Instagram I'm a lot more active on. There is a link on this to my Instagram, not to get likes or follows, but because I don't do a lot on YouTube anymore. But I hope this helps. If you guys need anything, or if anyone watches this and feels that they're going fucking crazy because they can't figure out what's going on with them and they were sick, you're probably not crazy, man. Or girl. I use man as a very gender neutral term, by the way, so I hope no one gets pissed about that, but I call everyone man or dude or buddy. So, you know, enjoy. I'm going to go over the shit I have on the table next too, because it's some kind of cool surplus shit, even though I can't shoot as much as I used to. Really amazing deal on this little buddy here, so we'll go over that here in a second.